Welcome to the White Coat Guide, your front row seat to the most extraordinary stories in medicine. What's something people don't know about the longest surgery ever attempted? On a humid morning in Singapore 2001, Raffles Hospital was charged with anticipation. Ladan and Laleh Bijani, conjoined twins from Iran, were about to attempt the impossible. Separation after 29 years joined at the head. Their dream was simple: see each other face to face, live independent lives. The world watched as they were wheeled into surgery, hope shining in their eyes. Inside, a team of elite surgeons prepared for a procedure never before attempted on adults. Months of planning had led to this moment. Every second would be critical. 28 surgeons and over 100 staff from around the globe stood ready. The challenge: separate two brains and a shared vein, risking everything for a chance at freedom. As the doors closed, the world held its breath. Born in 1974 in Iran, Ladan and Laleh's lives were a study in unity and individuality. Joined at the head, they learned to move in perfect sync, yet their personalities diverged. Ladan, outgoing and driven to practice law. Laleh, reflective, aspiring to journalism. Their shared dream: independence. Previous surgical attempts were deemed too risky, but their determination never wavered. "We are two completely separate people who are stuck to each other," they declared. Their quest led them to Dr. Keith Goh in Singapore, who saw not just a medical challenge, but a testament to human spirit. After months of preparation, the twins arrived in Singapore, inspiring everyone they met. Their courage galvanized a team to attempt the impossible. The greatest risk lay deep within their skulls. As craniopagus twins, their brains were pressed together, sharing a thick skull and, crucially, a single major vein, the superior sagittal sinus. Separating them meant dividing this lifeline without causing fatal brain swelling. Surgeons planned to graft a new vein for Laleh using tissue from Ladan's thigh, a procedure requiring microscopic precision. The team rehearsed endlessly, knowing a single mistake could be catastrophic. The marathon surgery would push the limits of anesthesia, endurance, and medical science. Every moment was fraught with peril. Success depended on managing blood flow between two lives, every step a leap into the unknown. A global team assembled, led by Dr. Goh and joined by Dr. Ben Carson and specialists from 5 countries. They used 3D imaging and virtual reality to map every vessel and bone, rehearsing each step like a symphony. The stakes were immense, not just a medical case, but the hopes of 2 women. Ethical debates weighed heavily, but the twins' resolve was clear. When the day arrived, egos vanished. Only purpose remained. The operating room was transformed for a marathon effort, with rotating teams and custom equipment. Every detail was planned, every contingency considered. The world's best prepared to push the boundaries of medicine. The operating room pulses with anticipation. Lights glare overhead as the surgical team scrubs in, their faces set with determination. Hours slip by. Gloved hands work methodically, scalpels glinting as bone saws whir, and the twins' skulls are carefully separated, millimeter by painstaking millimeter. The team huddles closer, breath held, as they approach the shared vein, a fragile lifeline pulsing between the sisters. This is the critical moment. Every heartbeat echoes in the silence. With trembling precision, a new vein is grafted for Laleh. Micro sutures thread through delicate tissue, each stitch a battle against time and fate. The air is thick with tension. Every suture tests the limits of skill and nerve, sweat beads on brows, eyes never leaving the field. Suddenly, alarms blare. Blood pressure plummets. Monitors flash red. Surgeons scramble to find hidden vessels, racing to clamp unforeseen connections as blood pools, urgency mounting. The operation stretches on, past 100 hours, fatigue etched into every face. The team fights exhaustion, voices hoarse, Hands trembling but steady, doubt flickers, but hope refuses to die. At last, the final cut, Lala and Ladan are separated. For a heartbeat, hope surges through the room. Relief floods the team, tears glisten, but the moment is fragile. Suddenly, both girls begin to hemorrhage, blood loss rapid, unstoppable. The trauma is overwhelming. Hands move frantically, transfusions flow, but the color drains from their faces. Despite every desperate measure, Ladan's heart falters. Her monitor flatlines. Moments later, Lala follows, her tiny body succumbing to the ordeal. The world's vigil ends in a wave of heartbreak. The team stands in stunned silence, grief and exhaustion mingling in the sterile air. Yet, even in loss, their commitment never wavers. The marathon of hope has ended, not in triumph, but in the unbreakable spirit of those who dared to try. News of the twins' deaths echoed worldwide, a wave of sorrow and reflection. Yet their story became one of courage, not failure. Ladan and Lala knew the risks, but chose hope and autonomy over certainty. Their legacy, a testament to the human spirit's drive for independence. The surgery advanced medical science, teaching invaluable lessons for future cases. International collaboration showed what's possible when humanity unites for a cause. The twins inspired doctors, nurses, and millions around the globe. Though they never saw each other face to face, their dream of individuality was realized in the world's eyes. Their courage continues to inspire, a reminder of what it means to dream and to risk everything for it.